Well, good afternoon. My name is Manuel Roman Lacayo. I am the Associate Director for the Center for Latin American Studies at the University of Pittsburgh. It is my pleasure to introduce yet another event on the Charlemos series. Today we have Jennifer Sir, Matias Bianchi, Sofia Vera, Miguel Carreras, moderated by Medica Bluefield. And the topic today is, what have we learned about Latin America's response to the pandemic 2 years in? Please, this will be, you'll be reminded of this, but if you should have questions or would like to participate, there will be a session after the initial presentation. And please put your questions or comments in the Q&A. But for now, I will leave you with Medica.
Hello, everybody. Welcome. It's an honor to be here moderating this session of Charlemos. And so today we have two very interesting papers that were published as part of a special issue for the Journal of Politics in Latin America. And it just came out, I think, 2 months ago, very recently. And so we pulled out two of the papers, and we're thrilled to have the authors discuss their findings. And so it's very fresh, new empirical research. And I'd also like to recognize that I think in the audience is Mariana Llanos, who's one of the co-editors of the JPLA. I think Rosana Castiglioni is on a very well-deserved holiday, so she's not here. But I wanted to mention that these are both these papers are from the JPLA, which is open access, and so you can get them easily for free immediately, along with another bunch of very interesting papers. So with that said, I would like to turn to the two authors, or two sets of authors, and we'll be hearing from Jennifer Sir, who is at the Universidad Torquato Di Tella in Argentina, and Matias Bianchi, who is at the Asuntos del Sur in Argentina, as well as the University of Arizona. And they will be presenting on governing a pandemic, assessing the role of collaboration on Latin American responses to the COVID-19 crisis. And they have two additional co-authors who are not here, but I just want to mention them, Lucas Gonzalez and Antonella Perini. Then we'll also hear from Miguel Carreras, who is at University of California, Riverside, Sofia Vera, who is at the University of Kansas, who will present or discuss, not really present, but discuss a tale of two pandemics, economic inequality and support for containment measures in Peru. And also there's a third author on that project who's not here, Giancarlo Visconti. And so we want to have a very nice interactive discussion here. And so I'll first let both of the author sets spend just a few minutes telling us what their research question was, and kind of walk us through it and tell us their findings. And then I have some interactive follow-up questions, but really we want to very much hear from the audience. And so please put your questions in the Q&A as they come up, and then we can try and have an interactive discussion. So I will turn it over now to Jennifer and Matias.
Hello, good afternoon, good evening, good morning, depending where you are. It's a pleasure for me to be part of the Charlemos, and I'm grateful for the invitation. I'm grateful for the audience that are missing an important match at the Champions League, and they're here with us, or they haven't noticed that there is a match. The paper we're going to be talking about, it's part of a larger project called Colaboralat, that is run by a consortium of think tanks and universities in Latin America that try to understand and trying to see the policies during the pandemic, specifically looking at collaborative governance. We designed this project at the very beginning of the pandemic, when we were looking at the different initial responses that were having different initial outcomes. We're talking about April, May 2020. And we understood that there was no country, no community, no organization that could respond to this policy challenge alone. So Asuntos del Sur is running this part of the consortium that is a regional, more quantitative research, and our partner universities are focusing more their field work in more qualitative research in specific dimensions of collaborative governance. One, the University of San Martin in Buenos Aires is looking at the metropolitan area of Buenos Aires, this poor neighborhood, how they're dealing. And our partners in Bolivia are looking at the informal economy in Bolivia. In Mexico, it's about women that work in households and different. So each one of our partners are looking at different dimensions, and we're mixing methods, trying to understand all of this. And this is a project that is very generously funded by the Canadian IDRC. Jen?
Great. So I will turn specifically to this paper. So Matias mentioned this, that COVID-19 as a pandemic, as a problem is very, very complicated. Its impact crosses borders, it crosses policy area. And so when we were thinking about sort of governance responses and what might be more effective, we thought in an ideal world, intuitively, governments would look to bureaucracy. They would talk to experts and scientists, independent scientists. The idea being, leveraging knowledge and expertise from different sectors to try to get at different interest groups and to try to reach different communities. And it turns out in the public administration literature, which I'm just now acquainting myself with, there is a term for this. It's called collaborative governance. So our initial hypothesis in this paper is that national governments that collaborate in terms of developing their COVID-19 policy responses will have more effective responses when it comes to the worst health outcomes, in particular when it comes to mortality rates. Why do we think this is happening? We tried out some of the mechanisms in the second half of the paper with some more intensive sort of case studies. But basically the idea here is that policies that are created collaboratively will be agreed upon by more potential veto players, right? So there will be fewer veto players. As a result, there will be fewer mixed messages being transmitted to the public, so citizens will know what actions to take to protect themselves and to protect others on the one hand. On the other, another mechanism, policies elaborated collaboratively, working with different actors across different spaces can lead to sharing resources versus competing over them, and also to distributing resources where they are most needed, right? Again, both of these things leading to potentially better health outcomes in this particular case. So how do we measure collaborative governance in this paper? I'm going to take a minute and a half on this and then hopefully finish. This is the first paper that we've seen that tries to collaborate qualitatively. It's very difficult to do. But we wanted to compare government responses in the region. And so we thought, well, what are some observable indicators that collaboration has taken place? At a minimum, national governments, and we're focusing here on national executives in particular, must have met with different actors for collaboration to occur. So we combed newspapers at 3 different times during the first year, at the beginning of the pandemic, at each country's sort of first peak, and then at the end of the first year, to look for indicators that national executives had met with different actors. In particular, had met with subnational executives, had bureaucrats at the national and sub.
Uh-oh, we may have lost Jennifer. Okay, so I suggest while we wait, hopefully for her to get back on as soon as possible, we jump into the other article and discuss that. And then we can go back to Jennifer and Matias because they're both frozen right now once they defreeze. So let me then swing over to Peru and a fascinating empirical study of that you conducted on public opinion. Yep.
Okay. So thank you very much for to the Charlemos organizers for the invitation to present our research and for everyone in the audience, and we really look forward to your questions. So our project is not really about government responses to the COVID-19 crisis, although it has clear policy implications. What we really try to do in the paper is to look at socioeconomic inequalities in Latin America and how those socioeconomic inequalities shape attitudes towards COVID-19 containment policies and compliance with COVID-19 public health guidelines, in particular in the case of Peru. So you might recall that in the early days of the pandemic, the COVID-19 disease was sometimes described as an equal opportunity offender in the sense that everyone was vulnerable to get sick, to get this new disease. However, it quickly became very clear that the most economically vulnerable sectors of the population were much more likely to suffer from both the health consequences and the economic consequences of the pandemic. And this is true everywhere, but it is even more the case in the Latin American countries that lack the ability to engage in large-scale policy interventions to assist their populations in need. So the first thing we do in the paper is to show the disproportionate effect of the pandemic on low-income groups in Latin America in general and Peru in particular. And we argue that there are three factors that make the negative effects of the pandemic on the more vulnerable sectors of the population more acute in Latin America. So number one, there are large inequalities in access to digital networks and to computers and the skills required to use computers effectively. So people who lack access to computers and internet, of course, cannot work remotely. Second, Latin American countries have large informal sectors, and informal workers are not protected against loss of income because they lack access to state benefits. And for them, not going to work might mean that they don't receive any form of compensation, which can have devastating consequences for them and for their families. And finally, poor families in Latin America tend to suffer from overcrowding and a lack of amenities, things like refrigerators or toilets. So public health recommendations to maintain social distance ring hollow in those types of environments. It's very hard to keep social distance in those overcrowded conditions. So, we established that, we show some descriptive evidence of that in Latin America, and in particular in Peru. And then we ask the question of how this economic vulnerability affects attitudes towards COVID-19 containment measures and willingness to engage in social distancing. So in a nutshell, we argue that Peruvians reacted to COVID-19 containment measures by considering the costs and benefits associated with those measures for them and for their families. So it's a very straightforward argument, building on a vast literature in psychology, economics, and political science that has demonstrated that self-interest is a powerful motivator of policy attitudes and human behaviors. So we basically argue that people with different socioeconomic groups weigh material and health considerations differently when considering how to react to these lockdown policies. So people who were in a position of economic privilege were primarily concerned with health risks and favored lockdown policies. So that's people who are in the formal economy, who can work from home, who have an office job, etc. Those people probably primarily were worried about the health and favored lockdown. The attitudes of more economically vulnerable groups, in particular poor informal workers, were shaped more strongly by material concerns. So we hypothesize that those individuals were less likely to endorse lockdown measures and to engage in social distancing. And in particular, we expect that economic vulnerability should increase the willingness of people to go out of their house, to go to work, even in those early days of the pandemic, where doing so was very risky in terms of potential health consequences. So now I'm going to let Sofia say a few words about our design and our findings.
Great. Thanks, Miguel, and thanks to the organizers of the Charlemos session. I'm just going to briefly say, to answer, this question of how economic vulnerability affects attitudes toward COVID-19 policies, we draw on an original survey in Peru. We conducted this survey in association with the Instituto de Estudios Peruanos in Peru. So the survey was conducted at the beginning of the pandemic, so in May 2020. And at that time, I don't know if you remember, the government had introduced very strong measures, and it was struggling with compliance issues. So we suspected that, these working and living conditions that Miguel just described in Peru, they were going to pose an extra hurdle for compliance. So we wanted to explore, a variety of attitudes toward the containment actions that the government had taken. So we explored two sets of questions. The first set of questions was about the support for a current quarantine. So we asked, to what extent citizens agree with the quarantine, to what extent they agree with reopening the economy and reopening gyms. And in the second set of questions, we asked about people's willingness to do certain activities in the near future, to go out to work, to attend a religious service, to meet up with friends, to go to the mall and to eat out. And so then to study how these attitudes and behaviors toward these strong quarantine measures vary across socioeconomic levels, we used an indicator constructed by the Instituto de Estudios Peruanos that is a weighted average of key questions such as access to goods and services, like the internet, a computer, bathroom, private health insurance, and so on. So we think that this indicator very well captures the multidimensionality of socioeconomic vulnerabilities. And so we use a linear probability model with fixed effects to estimate some predicted probabilities. And we find, in fact, as Miguel already hinted at, we find that the economically vulnerable individuals are less likely to endorse lockdown measures. And we also find that they are more likely to go out to work, but we don't find a similar result with other more social activities like meeting with friends, going to the mall, or eating out. So we think that together, all these pieces of evidence, we think that we interpret these results as suggesting that compliance was shaped by the economic considerations of individuals in economically vulnerable situations, especially the poor and the informal workers. Yeah, so
Okay.
Go ahead, Marike.
Thank you. That was a very nice summary. I'll turn it now back to let Jen finish her discussion, and we'll go on. Welcome back, Jen.
So isn't it the case? You go all day with no Wi-Fi problems, and then you sign onto something, and it's like everything goes haywire. So I'm trying a different part of the house. We'll see how it goes. I was really fascinated by what they were talking about. So I'm not exactly sure where it got cut off, but essentially our intuition is that governments that collaborate more will put forth policies that citizens will be able to understand better, fewer mixed messages, and will hopefully lead to resource cooperation instead of competition, and get materials to the places that need it the most. In these ways, sort of in the short term, having an impact on one of the worst health outcomes, which is mortality rates. So we build a data set by combing newspapers at 3 different times during the pandemic, at the sort of the first month or 2 of the pandemic, at the peak of the pandemic, and then towards the end of the first year, we develop a set of questions. To what extent, did the government meet with civil society on quarantine policy? To what extent did they meet with the private sector on quarantine policy? And we have 11 different questions, and we comb 3 different newspapers in each country, trying to control for some ideological differentiation. To what extent there's coverage about these meetings, right? And if there's coverage about these meetings, then we can feel pretty sure that something was happening. And so we ultimately come up with a total collaborative governance measure, right? A score. So more points. Each time we saw that the government met with one of these actors on a particular policy, we gave them a point. The more points, the more collaboration there was. And that is what leads to our collaborative governance score, or what we're calling an index, because it turns out that these dimensions, collaboration with these 5 different sets of actors, they actually correlate quite nicely with each other, quite highly. So I wanted to very quickly show, just so you can get a sense of what collaboration looks like. I mean, one of the things that we were really genuinely wondering was, is there going to be collaboration at all? In the sort of the beginning of the pandemic, there's this expectation that governments respond quickly, right? And so perhaps, collaboration takes time, working with different actors, it takes time, there's going to be some butting heads. So that there's variation at all, we think is itself an interesting finding. Can you see what I'm sharing here well enough? Yeah. Okay, so you can see here that there is in fact some variation across the 18 countries we look at. We end up dropping Nicaragua from the simple sort of correlations that we do later on because we just couldn't find data in any of the newspapers, and our team worked really hard, and so we just feel like we're just unsure about that. We're unsure about that score. It's very, very low. It's very, very different. Even cases where we would expect little collaboration, like say Brazil, when Bolsonaro had sort of denied the extent of the crisis, we still see instances of collaboration occur. So we dropped Nicaragua from the analysis, but you can see some variation here. Argentina becomes really important later on in the paper because it has a very high collaborative governance score, but when we just do these pairwise correlations, right? So collaborative governance score and mortality rates, and it has a very high mortality rate. So what's going on there? It's the sort of the case that we use in a sort of qualitative case study to see if, in fact, our intuitions make sense. And we can talk about the Argentine case in a little bit. I'm taking up too much time. So first, I'll just finish with this. First, we find variation, which is itself a real finding. It seems like different countries collaborated to different degrees. Does collaboration matter? Here, we have a very small data set. It's one point in time at the end of the year for 18 cases. So we have an N of 18 or 17, that's it. And so we do some very, very basic, simple sort of like cruces, right? Sort of correlations. And we do find in certain places, those governments that tended to collaborate more, we see in difference of means tests, we see that they perform better when it comes to mortality rates. So one example of this, and with this I'll end, governments that collaborated with social organizations on vaccine distribution. If we separate the countries that did meet with social organizations on this versus those that didn't, the difference in terms of the number of deaths per million is 493 for countries that did collaborate on average, and 839 for countries that didn't collaborate on average, and that is statistically significant at 0.02. So we are finding interesting things when it comes to actually statistically try to understand what's happening. And then finally, we look at case studies to help flesh out some of these very, very simple statistical regressions that we do. I'll stop there for now.
Thanks so much, all of you. Yeah, I mean, they then go on to do case studies of Argentina, Uruguay, and Brazil. And it's very interesting because, you have Brazil as the obvious non-collaborative, and then Uruguay super collaborative, and Argentina starts off collaborative and then kind of sort of collapses in the collaboration and deaths shoot up. And so it's really interesting. So I have just a few comments, and meanwhile, people, if you have questions, put them in the Q&A. So I'll start with Jen and Matias to probe you. I mean, I find the findings are compelling. It's very interesting. And so a couple comments. So you measure sort of outcomes rather than outputs. And of course, it would be exceedingly difficult to measure a set of policy outputs in real time with everything that was going on, like hospital beds, this kind of stuff across dimensions and in this short time frame. But of course, as you recognize, with deaths as a measure, like many other variables also relatedly and independently can influence these numbers outside of simply, government policy and collaboration. And so I was thinking, well, might it be that, and then, for example, you think, well, you looked at the first year and, of course, with Uruguay, then deaths unfortunately shoot up in the second year. So I thought that, well, might it be that collaborative governance is a necessary but not a sufficient condition to contain deaths? To think about it like that, right? I don't know, just I'd love to hear your thoughts. Then also to nuance the argument a little, how does pre-existing state capacity or kind of preparedness play into this? And how would you respond to someone who would suggest, for example, that collaborative governance may simply be an indicator of underlying state capacity, or that it's highly influenced by underlying state capacity and of pre-existing mechanisms embedded into the government, which might also be an indicator of collaborative governance beforehand. So, and then finally, just a little empirical question. How did you measure Venezuela? You dropped Nicaragua out because it's not transparent, but Venezuela came across as super collaborative, and it's like so non-transparent that I would wonder if it really belongs there. And then for Miguel and Sofia, this was super interesting, very well laid out, solid empirical finding, correlating material conditions with attitudes towards social distancing, and the very difficult trade-offs that it's not that you think that, oh, the virus doesn't matter, but you have no choice but to go out and make a living. And you use the country of Peru, which has one of the weakest state capacities in South America when the pandemic hits, with 80% informality. And even with that, like just a very, weak state infrastructure in so many ways. And while the Peruvian government then did jump in to extend social assistance, precisely the weak existing state infrastructure delayed that delivery by months, right? Aggravating economic hardships. And your survey was in May, way before the vast majority got their economic assistance. And so, so what I'd like to highlight is why this finding kind of seems, these regarding attitudes may seem obvious, i.e. material conditions influence your approach to this pandemic. It's not so obvious necessarily when you look at other contexts. And you guys state very interestingly that neither the Peruvian government nor the opposition politicized COVID-19. And the basic premise and evidence that social distancing does reduce contagion and deaths, and that Corona's real, is there, unlike what happened in many other countries. And in such a context, we'd indeed expect this kind of a relationship, and it leads to clear, straightforward policy implications, i.e. you need to extend a social protection floor for all these folks to avoid these sorts of trade-offs, and also epidemiologically then reduce the possibility of contagion and deaths. But in other countries, and you mentioned this also in your work, such as Brazil, the US, Bolivia, you have this kind of fomenting of what you call symbolic predispositions, right? Where the epidemiological response was politicized by either, the government and the opposition, and it became like a political wedge issue. And in the US and Brazil, these measures were opposed by the right, like stringent measures, and in Bolivia by the left. And so in this sense, for all its weaknesses, the Peruvian government, some of the other countries, Uruguay, Argentina, managed to avoid this. And that also kind of ties in with what Jennifer and Matias were talking about. It'd be very interesting for all of you to comment on this issue of, okay, so yeah, Peru failed in many ways, but no major stakeholder decided to use this as a wedge issue and then add this added problematic dimension. And then I had some questions. Maybe this is not the space there's more interest, but about your model and methods and kind of what kinds of variables you controlled for, because you do show this clear and very believable relationship. But then I wonder also how much did you control for knowledge of Corona, levels of education and stuff, because you also mentioned a lot of the more vulnerable households didn't have access to internet. So how were they accessing up-to-date information? And then it would be interesting to know if you have any data to support your thesis or actual behavior, like GPS data. I know some people have studied that a little, unlikely it'll match what you say about attitudes. But that would also be interesting to look at cross-nationally, is that like these attitudes and also in politicized versus unpoliticized context. Now I'm talking like specifically COVID, sort of as this wedge issue, and does that show up in attitudes and in behavior in different ways? But now I would love to just hear your thoughts, and anybody, all of you, jump in freely, and audience, if you have any questions, let us know.
Should
Jenna,
we?
Sure, Jenna.
Yeah, maybe we'll go first. Matias, you want to start?
Well, thank you for your comments and your insightful questions. We'll see if we can respond to some of them. The one I'm very interested about, the one on state capacities. We understand the collaborative governance doesn't explain everything, and there's an interplay with other variables. At this stage, we're not sure how much and how it operates. We have to tell you that we finished a second measure for our index, and hopefully JPLA will review our next paper. We'll see. So, and because there we see other we're going to be looking at other mechanisms. So what we understand is countries with similar levels of state capacity experience very different outcomes. Brazil had relatively high state capacities with very poor outcomes. Honduras, lower state capacities, but better outcomes. We also look at the BDEM data on state capacities and didn't fully explain what was going on. We also checked for political regimes, didn't explain outcomes. But definitely state capabilities explain a lot, and it would be interesting to better understand how they interplay. We understand that there are institutional regimes that are designed to collaborate, like federalism. This is institutional setup designed to cooperate and to create mechanisms of vertical and horizontal mechanisms. But if you look the behavior of the different federal countries in the Americas, it has been completely different. So it doesn't explain very much. In some cases, there has been fostered competition among states. In Brazil, it actually fostered collaboration vis-a-vis the federal government that was not being collaborative. We also understand there is a crucial aspect of leadership, the executives. Remember that in our index, we look at the executive level, the national government, how it cooperates with different levels. We understand that the leadership is crucial, but also we do not know how they're able to either institutionalize that leadership, how they can continue with that leadership, and why that collaboration diminishes or even collapses, like in the case of Argentina. Also in terms of it's been very interesting, the cases that we look at them more in the case studies in our qualitative research in the countries, the bottom-up collaboration of civil society and NGOs and different unions and different actors, especially when there is an absence of the state capabilities in those areas. So all of these are dimensions that I'm sure we understand that they interplay, but we're not pretty sure still the mechanisms, how they operate.
I just want to add to that. And say that we don't think collaborative governance is sufficient. We suspect I'm not even sure I would say it's always necessary. I think it's a very helpful choice to make. So we see collaborative governance as being a choice, right? Some leaders make the choice. Why do they make this choice? We're not quite sure yet. Sometimes existing institutions may help them. Well, we have, in the case of Argentina, they could rely on COFESA as sort of an intergovernmental organization. And so if collaboration is already the possibility of collaboration is already built in, that may enable collaboration. So that's sort of the next stage that we're looking at is trying to understand why they make this choice, because it's a really difficult choice to make sort of in the pandemic setting. And building off of what Matias said, we're finding some really fascinating results at the local level in the absence of the state, right? So just because there is collaboration in some of these cases, we're not suggesting that, well, we know it's not the case that Argentina's performance was, consistently good, right? So collaboration is also a choice that you sort of must actively make over and over again, unless you work to institutionalize those mechanisms. And then quickly about the Venezuela case, so it's a really good question. We had a long conversation about removing Venezuela as well before we even collected the data. I should say this. It wasn't like we saw the data and then we said, but we decided that we weren't excluding in terms of regime type. Nicaragua ended up being really strange because they just couldn't find the data. And I'm saying, the people who actually were collecting the data, we talked about it. Why? Let's go back. Let's look again. So we rely on 3 different newspapers. In the Argentine case, how much variation? The Venezuelan case, how much variation is there across those three newspapers? It's a genuine question. I think that we've seen some interesting. Speaking with some Venezuelan activists on the ground, opposition activists, they seemed to be less negative about the government response to COVID, the Venezuelan government response to COVID, which is to say that they recognize that the government has made some efforts to really combat the illness. So again, we utilize the same mechanism in Venezuela that we use elsewhere. We looked at El Universal, El Nacional, y Últimas Noticias. Those are 3 different newspapers. To what extent are they independent from? It's a very good question, but I didn't get to this point. It ultimately came down to, how many countries are we willing to lose in terms of having such a small N to begin with. So this is why we do not include Venezuela, for example, as one of the case studies, but it'd be interesting to look into that a little bit more. I'll stop there.
Thank you. I'll just turn it over to Miguel and Sofia, and then Alicia has a follow-up question.
Thank you. Maybe I'll address the question on symbolic predisposition. So we argue, our main argument is that people are self-interested, and low-income informal workers are more likely to consider their economic needs and reject COVID lockdown policies, etc. So other studies in other domains have challenged these self-interest explanations by showing that symbolic predispositions that are often acquired through socialization or through things related to the political culture can trump self-interest in attitude formation. So this is true in a variety of areas, and it has been shown also to be true in the case of COVID, in particular with some studies about attitudes of Bolsonaro followers in Brazil and Republican voters in the US. So the question is, why didn't that that those political or symbolic predispositions trump self-interest in the Peruvian case? And we argue that in the Peruvian case, those symbolic predispositions were simply not there because this issue was not politicized. So we cannot take that for granted. So we say, since the issue was not politicized and these symbolic predispositions were not really there, then self-interest should be the predominant factor there. So why were these issues not politicized in the Peruvian case, and why were these symbolic predispositions not present? I
realize that that's beyond like what you're saying, more of a speculative question.
Yeah, so speculating, so we think that this is in fact, we think that, or at least I think that these symbolic predispositions are powerful when they build on pre-existing attitudes that are connected to socialization. So in the US, for example, and more recently in Brazil, right-wing leaders and right-wing media often emphasize freedom from government intervention in a variety of areas. So for example, the issue of gun ownership in the US. So this idea of, this kind of libertarian tradition that, whatever the government does should be challenged, So the politicization of the pandemic probably resonated with these pre-existing attitudes among Trump supporters or Republican voters, and also to some extent Bolsonaro supporters. Although this is a newer, newer movement, it also, builds upon this rejection of government and the establishment. So in spite of the implementation of neoliberal economic policies in Peru, this libertarian tradition is much weaker in Peru than it is in the US and to some extent in Brazil. And that might explain why the issue was not politicized. Another factor that I can think of is how the incumbent reacted. So in Peru, Vizcarra was a very technocratic leader that had, he had a more technocratic profile than Trump and Bolsonaro, and he probably perceived COVID-19 as a crisis that needed to be managed rather than an ideological battle that he could use to, or he could exploit for political gain. So the initial reaction of the incumbent might set up, might create a narrative that then allows for these symbolic predispositions to either, Trump self-interest or not. So in both the Brazilian case and in the US case, I'm not sure about the Bolivian case, but in those two cases, the initial reaction of the incumbent was basically to challenge the, it's
Right.
gonna go away, it's a hoax, this kind of things that we didn't see in many other Latin American countries.
Right, and it's interesting just to throw in, like, because Vizcarra was his policies, as in Argentina, was super popular initially, right? He had like 80-90%, and so for the opposition too, it would have been very politically costly probably to challenge that. Like even if they were like strategic, self-interested, kind of like amoral actors who didn't really care about the pandemic and would try to, it would have been a politically costly move probably. Versus Bolivia, because in Bolivia, it's interesting, Cala Hamel and some of her co-authors, they've written on this, how in Bolivia, right, it was like the right-wing government, right, the interim government, and then it was the left that took this anti-stance, which was different than in US and Brazil, but of course that was an extremely polarized society, and you had two very mobilized opposed groups, and so it makes sense that they would fall on different sides of the issue.
Perhaps here I can add, something about the case of Peru and the role of Vizcarra. That is, he, was someone who was trying to, appear as an independent from political parties, right? And he, as you well mentioned, his measures were very highly approved. He had a very high approval rating at the time we ran this survey. This is May 2020. He still has a lot of approval, and it's early in the pandemic. So early in the pandemic that I think that political actors had not yet, in the case of Peru, built an opposition to these measures. Vizcarra had taken this very strict and swift response, but it wasn't heavily attacked by opposition parties, as government responses were heavily attacked in other places from the presidents themselves. So there wasn't, in the case of Peru, an opposition to public health guidelines such as big. And also let's remember, the case of Peru, partisanship is very weak and volatile, and you have that voters, don't always strongly, rely on parties and ideological positions to make decisions, right? Peru was still facing a lot of political instability after the resignation of PPK. So the context, the Peruvian context, political context also matters a lot, because parties were too weak to oppose Vizcarra.
Right, yeah. Alicia had a question. Follow-up question to Jennifer and Matias.
Perfect. So I had a quick question about measurement, and then it kind of bleeds into some questions about sort of the actual politics behind collaboration. So the question on measurement is that you're using newspapers basically to track collaboration. And we can actually imagine that perhaps the strongest cases of collaboration are when it doesn't need to be observed publicly. I can pick up the phone and call the president of the business association or the main labor federation, and that's very collaborative. but it's not publicly observed. And so I'm wondering, what are we missing by using newspapers? And in your qualitative case studies, did you ever have cases where, there was unmeasured examples of collaboration? And I can imagine, just as a different methodology, kind of starting with the associations and seeing, does the president of the business association say he or she was consulted? And then that leads into the more political question of, to what extent is this about signaling collaborative policy making, where a politician is the mover, sort of reaching out to civil society and maybe using it to legitimate policy, versus civil society organizations sort of clamoring, like, please consult us, like you're not taking into account, business or women or whatever groups might be the case. And then the last question really is about, the extent, and this builds off Marika's question about state capacity, but the extent to which other institutional foundations, whether they're legacies of corporatism or participatory institutions or planning institutions, are shaping these paths of collaboration when it comes to, a public health crisis.
Great. I'm gonna take the first question. So I think there is a reason why collaborative governance is not typically measured quantitatively. That's like in Charlemos, we try to be transparent, right? And sort of talk about the difficulties. So, this isn't a perfect measure by any count. We would never say that. In fact, my hedging a little bit on the Venezuela case already suggested that. However, I do think that, and, we talked a lot about this, like, how are we capturing these WhatsApp interactions, things that take place, of course, that are outside of the public eye. Of course, this happens. Nevertheless, we think that meeting publicly, and I should say, it's not just about the newspaper covering meetings. It's when policies are admitted, what actors are being credited for helping them make these policies, right? So it's sort of it's doing content analysis of all of the articles dealing with COVID in one way or another and seeing who's mentioned and how they're mentioned, right? So it's not just, well, today Fernandez met with, the Madres de la Plaza de Mayo, right? It's actual, if you look at the Uruguayan case, it's that, they create this amazing application, like within days of sort of addressing this problem, and this app that allows people to have information about testing and in the coverage of this app, which is literally created in like hours, I don't know, it's so fast. They credit sort of the private sector donating facilities, scientists coming together and working for hours on end without sleeping. So you really see, acts of collaboration, even in these sometimes surface level newspapers. Nevertheless, we think it probably underrepresents how much collaboration is happening, and that's better than overrepresenting in terms of trying to understand the role of collaboration. And I think maybe it also is sort of like a general reflection of some governments tend to be more collaborative than others. And we see, it may not capture all the collaboration, but we sure can see that Bolsonaro is not interested in talking with anybody, right? Or we sure can see that Fernandez is reaching out to these different groups. So it's not perfect, but I think as sort of our goal with the large end was to say, is there collaboration? Does it seem to matter? And it's a small end. So if we can find anything here, then we're starting at a really good place for thinking then more qualitatively. And it's at the qualitative level, and this is the wealth of interviews and focus groups that we're just starting to comb through now, that we're seeing a lot of what you would expect. Disenchantment with the national government, right? So just because collaboration occurs doesn't mean people are happy about it, but also local expressions of collaboration happening between social organizations on the ground, between social organizations and a union, between social organizations and local government. So that's where we're going to sort of tease out some of these questions, like first mover, who's the one that's reaching out to who? We can't answer that with the data we have cross nationally. My suspicion is that for national executives to collaborate, it's because they want to and not because a social movement is pressuring them to, unless we see like massive outpouring. Matias may disagree about that, but my sense is that the national executive is the one that's reaching out in the early moments of the pandemic. Like, what do we do how do we do this? Like, how do we respond to this problem? I'll turn over to Matias to talk about the harder questions.
Well, very, very quickly, regarding your second question, I think they do play a very important role when Fernandez decided to collaborate, to reach out to the different subnational governors and to reach out to the private sector and the scientific institutions, he stood up on the federal institutions that were already in place. Argentina has, by design, consejos federales, federal councils that bring together the different states, and some work better, some were worse, but it's been crucial, especially because the COFESA, the Consejo Federal for Healthcare, is actually, it was one that was working well. Beforehand, it was fairly well institutionalized, and it set up the statistics, a consensus for the provincial statistics on the pandemic, all the policies, the distribution of ventilators, all of that was early. It was a good institutional setup when the political will was posed there. And also, this is not our research. There is another paper from Rossi et al. That also works on the political coalitions that are in government. Some are more porous to social movements, and they were part of the government that helped them connect and distribute and where to reach out to the ones that needed help the most very quickly. That was another important variance. So the government coalition, the composition of the government coalition, and the linkages with social organizations and grassroots movements and unions was crucial. And my last point is about who is the first mover. We're looking at the national government from the beginning, but we've seen that it works in many ways. We've seen that when the federal government was resisting in Brazil, there was a coalition of hundreds of organizations that
support.
It just cut out.
Sorry?
Can you hear me?
Can
you hear me? Okay.
I think you're back.
No, you're back.
I'm back.
Yes.
So basically, what I was saying, that in Brazil there was a bottom-up process. Can you hear me? Can anyone tell me? Okay. That was socially, but again, to us, they have different muscle. There are hundreds of thousands of collaborative bottom-up initiatives around the region that are amazing, distributing foodstuff, distributing medicine, but the muscle that the government, national government have is completely unparalleled. That's why we focus on that kind of collaboration.
I now have a question from Scott for Miguel and Sofia that we have still a nice 5 minutes to address.
Thank you. And thanks for both of these talks. Really, really interesting subjects and provocative ideas and databases. 3 kind of quick questions for Sofia and Miguel. The first one is that this survey was done in 1 week in May. And I'm a little bit curious if you could talk, or I guess it would be speculation of how these results might change over time during the pandemic, and why it might have changed. The second one is selection bias. You guys noted in your paper, and I think Marika brought it up in her comments, that the poor are harder to survey, or they don't have access to the internet. And I assume this is a Qualtrics survey, and so obviously you can get a distribution on the income, but you're probably missing some of the people who you thought, your explanation is that they would be the least likely to be able to answer the survey, as well as the ones that are most likely to oppose the policies or be upset by the policies. So I wonder if you could talk about selection bias for a minute. And finally, I decided I'm a little confused about one thing, that you say that the issue was not polarizing or politicized, and yet you find this distinction between poor and others on the politics or their support. And I find that a contradiction in some sense of how you can have both of those things going on at the same time, or is it an emerging politicization perhaps, or something that is a political divide that's not yet, has not yet divided the electorate, but has the potential to in the fact. So it hasn't been absorbed in a sense by the politics. But again, those two things just seem somewhat contradictory to me. Thank you.
Maybe I'll take a few of those, and then so in terms of so we did this survey in May 2020, as you said, and in terms of how things evolved, the thing is this was a question about lockdown measures that were being adopted then. So the question wouldn't maybe even make sense a year down the road, because this later on in the pandemic, the governments became better at calibrating policy responses and adopting more measured responses that didn't necessarily include full lockdowns. But how doing it in May affects response? I think it does, because one of the problems with government responses to COVID in Latin America is that it was very hard to reach these informal workers, and there were government efforts that tried to reach them and to provide some form of relief, and those eventually made their way to poor informal workers, but often it took months, because these people were not in existing government databases. They also often didn't have online banking, so they had to go wait hours in line to get, and just to get, sometimes they didn't have a bank account. So these things took a long time to resolve. So I think that's why we think that probably the effects would have eroded a little bit, maybe because some of those economic considerations might be not completely resolved, but maybe less dire, maybe if this survey had been conducted in June or July or August. So that's my intuitive reaction to that. And in terms of the politicization, what we mean is that because the issue was not politicized in the sense that there was no one party saying COVID is a hoax, you should never, you should not abide by public health guidelines, you should not you should never stay at home because this should go like Trump was saying by in May everyone will be able to go about their life normally. It's just like lockdown is just for a couple of weeks. So there was a political actor telling people that COVID would be a swift crisis that would resolve quickly and that people would be able to go back to their lives, and so minimizing the risk of the pandemic. We didn't see that in Peru. So in that sense, it was not politicized. And because it was not politicized, we see this difference that we see, because self-interest kicks in. And when you think about the self-interest, if you are like a person who has a nice house and can stay at home and isolate from COVID, my self-interest is to protect my health and my family's health. But if you are a poor, informal worker who all of a sudden, all your sources of incomes are dramatically shut off, then your self-interest is like, how do I make sure that there's food at the table next tomorrow or next week? So that takes the health considerations are still in the back of your mind, but they take second place to making sure there is food at the table. So I think our findings are consistent with a lack of politicization. If the issue had been politicized, maybe poor workers or poor people might have reacted in a different way that would be more consistent with symbolic or ideological issues rather than with self-interest. So in that sense, we think it's consistent. And maybe Sofia, if you want to take the selection bias question.
Yeah, thanks. I guess I'll add to the politicization question that so we think that that we find these divergent attitudes toward the policies based on socioeconomic conditions. We think that evidence perhaps is, in the case of Peru, is much more about the economic necessity of these people rather than their perhaps partisan attitudes or their ideologies or their perceptions or lower risk lower health risk or something like that that have been shown. For example, in the case of Brazil, maybe Bolsonaro voters were had these perceptions of having lower risk. So I think that just to add to that in the case in this case there were these big figures that were pushing for these ideas, and that this evidence is much more consistent with the economic necessity of these informal workers that needed to make a living. So in the case of so regarding the question about selection bias, so this survey was not an online survey. It was a telephone survey, mobile telephone survey. And so the folks at Instituto de Estudios Peruanos are doing a great job at trying to reach people in every single region of the country. So they have a very well spread survey, and in that sense, we are not so worried about not capturing individuals in the lower levels of socioeconomic status. We are confident that we reach a very diverse set of people from different social economic background in most of the regions of the country, because that's kind of like what the method is allowing us allowing us to do. So we are if it was an online survey, perhaps we would be a little bit more worried about the fact that perhaps these folks were much more affluent, and perhaps their affluence would have made them respond more in favor, according to what we would expect. We would find smaller effects in terms of socioeconomic factors affecting their attitudes toward COVID measures. So we are not so worried about that. I think that's pretty much answering. Is that answering your question? Yeah, I think those were your questions, Scott. I hope that I answered them.
Thank you so much. I think we're 5 minutes past the hour, so we should probably bring this to a close, but very interesting work. Thank you so much for sharing it with us, and thank you to the audience. I'll close.
See you soon. We'll see you soon. Thank you so much, Miguel.
Hasta la próxima.